doing a postgraduate degree in public health, and I've organised this continuing education conference over the next 2 days to try and improve the overall level of the dental professionals on the island.
What do you think that was important?
Well, I think that in any profession, whether it be in the medical field or otherwise, I think that things are constantly changing, and you want to make sure that you're abreast of the latest developments and whatnot. Insofar as it relates to the dental side of things, it's a health profession, and you want to be offering the best and the most current things that we have on offer at the moment. So if you graduated a long time ago, things are going to have changed, and if you're not continuing your personal education in that, then you're going to be left behind.
Do you think that continuing education should be a mandatory requirement for them?
Yeah, certainly. I think that there should be some minimum requirements. There's things that in other countries are mandatory, so for example CPR, a lot of health and safety aspects, but it shouldn't. That's just a bare minimum. I think we should all be, as a profession, trying to up our game and up our level.
How will you go about trying to make sure that it is mandatory?
Well, I think that hopefully we can garner some energy in the Dental Association to maybe put some pressure on the decision makers to make that a mandatory requirement.
Is there anything that I did not say that you wanted to share?
No, I think that we have to give credit to Dr. Michelle Codrington. She has organised bringing in a lot of the public health providers, and she's shown great foresight in doing that. And if that level of care could be equaled in other practices and in other institutions, then it's only going to be a good thing for the general public overall. Other than that, I'd just like to thank my supervisors, Dr. Peter Shamey, Dr. Tamara Nanku, and Dr. Heather Herwood at UE, who have been supportive in this whole journey.
During the presentation, the doctor mentioned that people prioritize other things that they want to do that could also be costly. He was just suggesting that people also prioritize their indemnity. What are your thoughts on this?
Yeah, I think it's great that people are taking that interest. It would be fantastic if the dentists could equal that level of interest. I think many times what we have a problem with is we're constantly addressing emergencies and not necessarily addressing the wants and desires of people. So we're treating out of necessity more often than not. And if we can highlight that many people can kind of avoid these types of situations, then those energies can be focused more on some of the other things that people maybe are looking to do but don't think are available here in Barbados.
It's dental insurance a part of perhaps your push to ensure that that's a bit more accessible for people who might not be able to afford it?
Yeah, I mean, it's quite interesting because many people have dental insurance but don't actually make use of it. So things like a checkup or getting a cleaning or relatively straightforward x-rays, they're actually covered, maybe not 100%, but a portion is covered by the insurance. And there's many patients who I see who come in and they'll have an insurance form, but this is their first visit and they're only coming when they're in pain. And I think that's a shame because obviously there's the facility there, and ultimately that helps everybody. It actually helps the insurance companies, because if we can get in early and we can actually prevent problems from happening in the first place, well then, it's going to reduce the outlay from their perspective. The patients win simply because they don't have to suffer pain in the first place. And the dentists also benefit from the fact that they have patients coming in who are getting their cleanings and their checkups done on a regular basis. So that would be a nice message to get out to the general public, that if you have that, make use of it.